Now I'm going to cover how we would go about treating an anaphylactic reaction. Now some of the things I'll cover here are specific to where we work in Sedona, and it may vary from place to place. Again, I want to emphasize this is just for trained medical personnel, and I'm just showing you as a demonstration so that you can get an understanding of how some of this might work. Now I'm going to start here. In this we have all of our airway products. And as I mentioned earlier, our biggest concern with the anaphylactic reaction is the patient keeping an open airway and that the patient's going to be able to breathe okay. After that, we want to be concerned about their circulation, make sure that their blood pressure stays high enough so that they can circulate. So in this box, on just about every patient that's having any type of difficulty breathing, our first priority is to be to get them oxygen. Now we have our oxygen cylinder here, and then in here we have different devices that can deliver the oxygen. Now it ranges from a nasal cannula. The nasal cannula is just a small one that sits in the nose. That's for low amounts of oxygen. And then we have a non-rebreather mask, and that's going to provide a lot more oxygen. With anaphylaxis, most likely we're going to go with the most amount of oxygen that we can provide. So these are good when the patient's breathing on their own. If the patient gets worse and they're not able to breathe on their own, we have here what we call a bag valve mask, so that we can breathe for the patient. And then also some other things that can help to make sure that their airway stays open. This gets a little more advanced. If the patient were to go unconscious and not be able to maintain their own airway, in here we have a bag to where we can intubate the patient. Now intubation, for those of you that don't know, is where you put a tube in the patient's airway, and that way we can keep the airway open and breathe for the patient. That would be a worst case scenario. I guess that would be a progressively worst case scenario. The absolute worst case scenario would be that this patient's airway were to close completely, and we'd have to do a cricothyrotomy. That's where we'd have to cut the throat and induce an airway that way. Without getting too much into it, though, this is kind of the basics of the stuff that we provide. Next, I'm going to cover some of the medications that we carry and how we might treat them that way.